Hello everybody, my name is André Lee and I'm the Deputy Director of the Institute of Music Physiology and Musicians Medicine here in Hannover in Germany. And I'm running the institute together with Professor Altenmüller. I was very happy to welcome Professor Chang-Kyun Lee here at our institute and to introduce him to the work we're doing with regard to music physiology and musicians medicine. So Professor Altenmüller and we are both neurologists, and therefore we are of course extremely interested in the neuroplastic changes that are induced by high-level music making. So what can we see? What does music making change in the brain? And with regard to musicians medicine, we are interested mainly in task-specific movement disorders. So of course task-specific dystonia of the upper limb, sometimes even of the lower limb. So we had a couple of percussion players who did have a focal task-specific dystonia in the lower limb, but also, of course, in the woodwind and brass instrumentalists, the embouchure dystonia. And my personal focus of interest has been the last couple of years, actually since I'm in musicians medicine, the focal task-specific tremor in musicians that occurs most often in string players, in the right arm of the string players, so this involuntary trembling of the arm. But of course that can affect also the embouchure, and we also have seen, for example, pianists or guitarists that suffer from this movement disorder. So with regard to pain research, for example, we are assessing pain perception and also pain processing with the 64-channel EEG. And what we found was very interesting. So we do have first results that show there is a difference between musicians and non-musicians. So when we stimulate musicians with a painful heat stimulus, what we see is they rate the pain stimulus more intensively, which is maybe not surprising, what I expected. But very interestingly, the adaptation to the pain stimuli is faster and larger than in non-musicians. That means that they perceive the stimuli less and less and less painful in a faster way than non-musicians. So I think that was kind of unexpected. And we're very much looking forward now to evaluate and to assess the EEG data with regard to this behavioral data. And of course, then the next step will be to have an MRI study looking at functional differences. Then with regard to focal task-specific dystonia, we are having a genetic study in collaboration with the University Clinic in Lübeck. So we're looking at genetic risk factors, and we're participating in a nationwide dystonia register, and our part is to contribute with musicians dystonia. Also with regard to tremor, which has been my main focus of interest the last 14 years, we are also conducting a functional and structural MRI study in cooperation with the University Clinic here in Hannover, because there is no study about this so far in task-specific tremor in musicians, and we're very much excited to see the first results with regard to functional and structural differences, which should be coming up this year. So I'm sending my best regards and my warmest wishes for a successful and fruitful second KAMA symposium in January. And I'm very much looking forward to, of course, hearing from your research projects and also to collaborating with you.